Good evening, Los Angeles, and thank you for joining us. Today, all of our hearts are broken. Already before tonight, we had lost too many Angelenos to this crisis. But today we learned that here in LA County today, a teenager in good health succumbed to this virus. As a father, as an Angeleno, my heart goes out to the family who tonight knows that their child won't be coming home. And to the young people who are out there, we grieve alongside you as it begins to hit us all how serious not only today is and these past days have been, but what the future days ahead will be like too. To the young people that are out there, this can hit you too. Know that your behavior can save a life and can take a life, and that life could be yours. And to all the families who are grieving of the 11 individuals we have lost, I start by remembering them and thinking of you. To everyone tuning in tonight, we know now how serious this is, and we know that we are all at risk. There's nothing we can be doing more vital than preventing the spread of this virus, keeping people healthy and saving lives. That's what we are focused on. Some of you know that when we had fires recently, I was talking about how quick people should just get out of the house, that everything can be replaced but a human life. Today it's kind of the opposite message. Instead of getting out of the house, we're asking you to stay in. But the message is the same. Everything else can be replaced. Everything else, even in dark days, can be rebuilt. The only thing that cannot be replaced are our lives, our own and those of the ones that we love. So let me update you on the work that we are doing to save those precious lives, and thank you again for the extraordinary work that you are doing to help us save lives. 2 days ago, I shared that Los Angeles was launching an online portal to be able to do testing for COVID-19 through 4 locations where individuals could drive up and self-swab and then get the answer to whether or not they are positive for the virus. By the end of today, I wanted to report that we've been able to, or will be able to, have done 2,800 tests. This is just in 3 days of work. And we have the capacity to double that in the next 3 days. By double, I mean double the capacity to an additional 5,500 tests. Every test is crucial, and I wish we could be doing so many more. But I'm so proud of the people who have stood up these centers, the folks that are out there making sure that these tests get processed, working 24 hours a day, and the measure of relief it is giving to those who come up negative, and the assistance it is giving to those who are positive to get the health care that they need. To meet the criteria, or to see if you meet the criteria, I urge you to go to coronavirus.lacity.org. If you are feeling those symptoms, if you have talked to a medical professional, and we still encourage you, use telemedicine, call somebody first, don't walk into a hospital, and if you're in one of the vulnerable populations. And we will continue to open up the aperture of how many people can test as we build that capacity. The County of Los Angeles and the City of Los Angeles are working on this together. Many other cities are working on this, from the Antelope Valley to Pasadena to Long Beach and others. And we are going to share those centers with everybody because every life is important. So thank you to all that are doing that work. And I'm relieved that folks are signing up to get tested. But like many of you, I'm still frustrated. Frustrated because we can't scale this up fast enough in a crisis like this. We can't build enough laboratory capacity. We can't have enough protective equipment. There aren't enough healthcare professionals to safely and quickly administer those tests. So while we're ramping up our testing capacity here locally, we need to do so much more. I was relieved today to hear that the White House is ramping up and prepared to use the Defense Production Act to secure more testing kits and supplies. But those resources need to make it to Los Angeles quickly to have the impact that we need. I did some calculations, and We are anywhere from about 6 to 12 days behind what we are seeing in New York City, our sister city on the other side of the country, where more than one American is dying each hour. And our hearts go out to New York City and Seattle, and increasingly this entire United States of America, where we are losing Americans to this virus. And will we be having the same conversation in a week from now, not about testing, but about ventilators and other equipment? We need the federal government to continue acting quickly to make sure that we can get the supplies that we need for those professionals who are bravely meeting this challenge head on. And I will do everything in my power to continue advocating for that. Now is the time for partnerships and not for politics. We can't wish coronavirus away. And let me just pause and go off script for a moment, because I know that everybody is hopeful, and some are putting out that hope of us being back in churches by Easter or synagogues by Passover, of restarting the economy in a couple weeks. I think we owe it to everybody to be straightforward and honest that we will not be back in Los Angeles. We will not be back to that normal in that short period of time. I have said to be prepared for a couple months like this. And just as I took action to act quickly at the beginning, and I said when it feels wrong, it's the right time to do it, by the time it feels right, it's too late. The same goes with how long we're going to have to keep these measures. We won't extend it one day longer than we need to, but just because we're having success, sometimes we have to keep seeing that through. And that goes for this entire country. I've spoken to my brother and sister mayors across the country, urging them to take action, even sometimes in smaller places before they have their first case, because it is coming everywhere. And the faster that we act, the better we can protect all of us. We are one country, and Los Angeles is a critical city, not just to California, but to every American. And so while first and foremost everything I do is for this city, it is also for the good of this country, and I hope that all of us in this nation will keep that in mind. Tonight, let me discuss a little bit more about enforcement. Many of you have called, questions from the media, and my Safer at Home emergency order is clear. It requires residents of Los Angeles to stay in their homes, and the only exceptions are the only exceptions. It limits all outdoor activities to minimal exercise and what is absolutely necessary, though by minimal, I don't want you to not have a good workout. We just mean stay away from each other. And it closes non-essential businesses that require workers to be present in person. Cut back gatherings, measures that we have taken to extend our physical distancing. All of these things together, some of which we took nearly 2 weeks ago, and all of which we took now at least 6 days ago, are working. We're seeing in all the data that we're getting that people are not moving, that they are staying at home. I know how tough that's been for you, physically, emotionally, socially, but thank you for doing it. And thank you as you settle in for looking out for yourselves, for checking on each other, for taking care of your mental health, for making sure that you're abiding by the letter and the spirit of the order. But we saw some people this weekend too close together, whether it was at our beaches or whether it was playing sports, which is why, as we said yesterday, we closed down our group sports and recreation at park facilities across LA, closed our playgrounds, and shut down city parking lots at city beaches. Yesterday, the county and state closed their parking lots at their beaches as well. And tonight, with the city of Santa Monica, we are shutting down the Santa Monica stairs on Entrada Drive, a popular staircase used for exercise that has become too crowded to be safe. I know each one of these feels like a cut, but it is quite the opposite. It is a cure, part of the healing that we need to get well and to stop the spread. No level of government takes these actions lightly, and we've made each of these decisions with the best consultation with our public health officials. And as I do every night, I want to thank Dr. Barbara Ferrer and our county public health workers that are stretched so thin right now than preparing for the onslaught. But everything we do only works if everybody does it. It only works if the people who need to stay home do so. It only works if businesses that are supposed to temporarily halt operations make those adjustments. It only works if each one of us sacrifices. Most Angelenos have stepped up, heeded the calls to practice physical distancing, and I'm so grateful for that. But it isn't enough. We're still getting reports each day of non-essential businesses that continue to operate as normal. This behavior is irresponsible and selfish. It may serve a few people for a moment, but it will put all of us at risk for a long time. That's why the city must strongly enforce these measures that we have put forward to protect everyone's public health. City Attorney Mike Feuer and his team have been great partners over the past several weeks in responding to the emergency, and he has assigned our neighborhood prosecutors, which cover every police station in the city, to implement and enforce each of our public health and safety measures. Thank you. Our city council members and their offices have been the eyes and ears out there too, and I want to thank each and every one of them. But when our neighborhood prosecutors at the city attorney's office, members of our legal force assigned to different areas of the city, receive complaints about local businesses, they will now contact those businesses to warn them of their violations before escalating to stronger enforcement measures. In addition to these prosecutors, tonight we're also launching the Safer at Home Business Ambassadors program. These are folks who can help us get even greater adherence without the threat of the law. How it works is simple. If a non-essential business is refusing to comply with the order, city workers and volunteers from my crisis response team will join LAPD in obtaining voluntary compliance with our directive. The easiest way to avoid a visit from the city is to follow the rules. Where this does not happen, we are ready to deploy these folks, identify businesses that are not doing what they're supposed to, issue initial warnings, and if necessary, share information on recurring non-compliant establishments with LAPD for further enforcement that may result in a referral to the city attorney's office or citation actions. And when we take in the calls to 311 and the mayor's help desk about enterprises that remain open but should be closed, the city attorney is going to take care of those as well. So if you know of a shop that's failing to do as asked, give them a call and ask them to do what's required. Remind them, and if they won't, refer them. Because if we see continued noncompliance, they'll wind up facing a misdemeanor charge, and DWP will step in and shut off their water and power. Even, as I want to reassure folks, while residences will not have water and power cut off. Believe me when I say nobody wants to be punitive at a time like this. My ideal is 100% self-compliance, and we all hope for the same thing. We want fewer people to get sick and die. We want this crisis to end as soon as possible, and we want to be able to take care of the people that we love most dearly. We can achieve those goals, but only if we all do our part. So let me speak directly to the non-essential businesses that are still operating against the law and still requiring people to come into work and still putting everybody at risk. You know who you are. You need to stop it. This is your chance to step up and to shut it down, because if you don't, we will shut you down. From the start of this crisis, we've seen our partners in the private sector, our manufacturers and our grocers, our healthcare professionals, our philanthropic community, and everyday citizens step up and join us in doing whatever it takes to meet the challenges of this moment. And every day we're seeing more evidence of that spirit of generosity and that LA love, as I call it, across our city. Last week, I stood with leaders from our grocery stores at a local food distribution center in Paramount to deliver a clear message and a visual message that there is no shortage of food. There's no reason to overbuy, and hoarding groceries risks lives, while our goal is to save them. This afternoon, the California Grocers Association reinforced that call with their Enough for All campaign. They're delivering the same message. Don't rush the stores. Go back to the pace of buying that you always had. And that's a message coming directly from the people on the front lines. The cashiers at our local markets who you put at risk when too many of us pack in. The workers restocking our shelves, working alongside you. The drivers getting food to our neighborhood grocery stores. These are some of the essential workers helping us get through all of this, to be nourished, to be fed. And we should be all grateful to them and heed their call tonight. There's plenty for everyone. Truck drivers will keep delivering food, grocery workers will keep stocking the shelves, markets will continue working around the clock to resupply their stores. We simply ask for all shoppers to practice safe physical distancing at all times. Stay patient. Our days are suddenly a little bit more wide open, and stay calm while helping all of us stay safe. We're also constantly looking for new ways for people to make it easier to get involved and to add their expertise in this fight. And I want to speak to a particular group of people right now who we need more than ever in this fight. There are few Angelenos in more demand right now than medical staff, doctors, nurses, technicians, anyone who can test, who can treat, who can heal, who can tend to our patients' concerns. So tonight, we're announcing that together with the county, we've created an easy-to-use, one-stop portal where medical professionals can submit their information and sign up to help. Many doctors' offices are actually closed that do elective procedures. Those folks might be listening right now at home wondering, how can I help? Well, this is your shot. If you're a medical professional and you would like to offer support in response to COVID-19, paid or pro bono, simply go to coronavirus.lacity.org/medical worker. That's coronavirus.lacity.org/coronavirus. And fill out your basic information about the skills and experience that you have, your background, your training, and your availability, and we'll follow up with what we need. Finally, we are blessed here in Los Angeles to have industries that not only fuel our city, but fuel our country and our world's economy. E-gaming is one of those industries, and one of the leaders in that space is Riot Games. Probably some of you have been playing a lot of League of Legends since you've been home. They're based right here in our city, and today that company and its founders are donating more than $800,000 to local nonprofits, including $200,000 to the Mayor's Fund to support whatever is needed for COVID-19 relief, including those senior meals, the healthcare, child care, and also, of course, the work that we are doing to help Angelenos get cash grants. On top of that financial contribution, Riot Games is working to secure critical personal protective equipment, PPE, for LA's hospitals, like much-needed masks for our professionals to protect frontline doctors and nurses. And knowing that this is a moment of strain and anxiety for working families across our region, Riot Games is committed to doing right by its workforce, keeping facilities, janitorial, and food staff on their payroll for a full week while their staffs work from home, while they work from home. Right now, there's this debate raging between whether we need to save our economy or preserve public health. Folks are asking, should we sacrifice our economy to save lives? And I want to speak to this directly tonight because I think it's a bad question and a false choice. Because only by saving lives will we be able to reboot our economy. The sooner we flatten the curve, the sooner we get ahead of this, the sooner we'll be able to return to restaurants, the sooner our trails will be open again, the sooner we'll be able to get together for a family outing with our parents and grandparents, but not before. Because to place the economy before individuals, profits before people, that will cost lives. And as I said, that's the only thing we can't replace. Harder decisions made today, greater sacrifice at the beginning of this crisis, will mean one fewer Facebook reminder a year from now of a loved one that we've lost. That's what we're dealing with here. Every day is a chance for each one of us to make a difference. Every day is a chance for us to connect. And in this time of unprecedented crisis, every moment is an opportunity for us to save lives. All of us want to see things go back to normal. All of us. But the premature pronouncements that we can see that light at the end of the tunnel, I would say we're just entering that tunnel right now. And we need to be prepared for some of the darkness that is ahead. But as I've also said, each one of us can be a light. We can light a match of hope. We can navigate that tunnel with each other and not alone. And more importantly, what we do can ensure that more people exit that tunnel together and healthy and strong, and that our city will rise again stronger than before. No one can predict timelines, I don't want false hope to crush the great spirit we have and the commitment across our city. We have to be prepared to be in this for the long haul. I've said that from the beginning. I'm sorry to be that messenger, but it's what I owe you. The honest science, the data, and the medical recommendations that we get every single day. And this is my chance every single day to share that with you. The most important thing for our city is not the amazing hills, the beautiful coastline, the incredible buildings that we have built. It's the people of LA. Take everything else away and just leave the people, and we still have an extraordinary city. For all of us, to preserve that brilliance means sticking with our basic tasks, washing our hands frequently, practicing our physical distancing, and staying safer at home. For our essential personnel and disaster service workers, doing your part means showing up to keep our neighbors healthy, housed, and fed. And I want to thank the 1,006 LA City disaster service workers who have stepped up to serve. You are truly angels in the City of Angels. And for those of us who can, it means digging into our pockets, giving a little extra to our neighbors, support the churches and synagogues and mosques, the nonprofits who are serving people today, to help workers who have lost their jobs and worry about paying the rent, the emergency personnel and first responders who need the masks and gowns and anything that we can give them. And for our city, it means continuing to take steps to protect you and your loved ones, to do whatever we can to ease your anxiety and fears, to talk you through the most challenging time in our lives, and to keep those vital services you depend on running. We're in this together, Los Angeles. So stay safe, stay healthy, and stay home. Strength and love to you all. With that, I will take some questions, and then I'll come back, as I do usually, to speak to our Spanish-speaking Angelinos as well. I'll take the first question. Thank you.
Thank you. Hi, Mayor. We have our first question from Alex Michelson with Fox 11 News, and please go ahead.
Hey, Alex.
Hi, Mayor. Thank you so much for doing this. You mentioned the young person that died, 18 years old. Do we know if this individual had any pre-existing conditions, any lung conditions? What more can you tell us about this person's case?
I was informed by the county that this individual did not have pre-existing conditions. And it's a sober reminder that this can take anyone, somebody without pre-existing conditions, somebody who's not a senior, and even those categories that we think were completely immune. The tragedy of this moment reminds us that anybody can die from this disease. So that is the information that I received, that this individual did not, that it was a teenager up in the Antelope Valley and in Lancaster. I think that's been announced publicly. And our heart goes out to his or her family. Thank you.
Thank you. And I'm going to remind everyone that is on the phone for questions that if you'd like to get into the question queue on the phone, please press 1, then 0 on your phone keypad. And if you are using a speakerphone, please pick up the handset before pressing the numbers. Let's go to Steve Gregory with KFI News. Please go ahead.
Hi, Steve.
Hi, Mayor. Good evening. Listen, you're looking at modeling. You're kind of having to project the future a little bit, and I know everyone keeps asking you
Sure.
when the end is going to be on all of this, and I know it's frustrating to do, but seriously, how long do you think the city can sustain being closed, especially the non-essential businesses and the economy here? How many weeks do you think the city can tolerate this?
So I don't want to downplay for 1 minute the impact it will have on individuals and on families, many whom lived paycheck to paycheck, have no savings, are in debt, and who are now unemployed. And that's where we're trying to advocate first and foremost for help from both Sacramento, which has been forthcoming, and Washington, which I hope will be forthcoming soon, and here locally with the money that we're raising. But I've also looked at a number of these pandemics historically, and economies can come back sooner and stronger than we expect when that pandemic ends. The problem with this is it's a new virus, and we don't know exactly when this will end. I don't believe any pandemic will go on for years, but we know that we will have to wait for, as the professionals have said, a year or a year and a half for a vaccine. Hopefully before that we will find drugs that can intervene and treat people and save lives before that. And we know that if we're successful in pushing that curve out, that means fewer people will get it now, but more could be susceptible before medicine or a vaccine is available to get it, as we see in flu seasons. Again, in October, November, December, so we could see again another spike up that could require us to change the way we are living. I do believe, looking at the recent history, when you look at places like China that have practiced this, other places that have done this in Korea and elsewhere, that it isn't just a period of a couple weeks, that we should be prepared for at least a couple months. I think that is why it's critical for Washington to think about the workers and the industries that employ them together, to not leave either of them behind. To help people meet payroll is a great way to keep people with the dignity of a job, keep an industry going too without folding. So I can't predict that standing here, Steve. I can't let you know what the economy can take, but I also know that if the healthcare system goes on permanent overload and we have tens or hundreds of thousands of people dying, that will have a huge economic effect because people simply won't be going to work at that point. We're seeing folks in New York right now trying to leave New York because it's so bad. And as I mentioned, we're probably 6 to 9 days, maybe 12 at the outside chance of being where New York is. We're about 6 days behind in terms of number of cases and deaths where they were 6 days ago. But again, I think we have a few more days because we implemented measures a little bit earlier. But it's coming. The peak is not here yet. The peak will be bad. People will lose their lives. Many of us will know those people. Tragically, some of them will be our family members or even people watching here today. So for me, the best way to save the economy is to save lives. Next question, please.
We're going to go to Dakota Smith with LA Times. The line is open.
Hi, Dakota.
Hi, Mayor. Do you have any estimates of how many people will become infected or are infected in LA County?
Not yet, and we need that. There was one small sample study that was done. The governor's office helped do in 3 different counties, in Orange County, Los Angeles County, and Santa Clara County. I believe the number that came back was as high as 8% of LA County residents. But I would say that with a big grain of salt. We need comprehensive testing of random people to really get a real number. Anything else is speculative, and I think that sample was very small. So 1 or 2 people could cause that to be 8%. I don't think that's mathematically confirmable yet. When we build up our testing capacity, I'll tell you, I've asked our people here and working with the county, USC, some others, UCLA is working on this too, can we take some of those test kits, get a demographically representative sample, and over a series of 4 or 5 days, test people who are just randomly selected. Some of them might be symptomatic, but most of them will be asymptomatic, and we can find out truly how many people statistically are probably infected. The modeling that people have looked at, it ranges wildly. We've seen some of the worst case scenarios, like what the governor shared, that 25 million, some 60% of the state could be infected at some point. Other ones have said a good middle of the road estimate is 20%, but in LA County, that's 2 million people. So right now, we don't have any number beyond 1 single digit estimate, but I hope if we get the tests, and I want to thank again folks like Councilmember David Rue and folks in the county, Dr. Kazan, Dr. Eckstein, who are both working on this, the more tests we get, the better chance we have to actually finally know how bad it is out there. And that's the last thing I'll say on this is nationally, to those communities who say we don't have a case yet, I'd be surprised if there's any medium-sized, let alone large community in America that doesn't actually have people who are definitely infected. Thank you. I'll take the next question.
And we'll go to Claudia Pashuta with KNX Radio. Please go ahead.
Hi, Claudia.
Hi, Eric. I have a couple of questions
Sure.
for you. I'm wondering if eviction protections during the crisis will extend to people in sober living facilities who are considered guests and not renters. And then I believe you had said something about announcing something tonight regarding possible incentives for manufacturers to get them to switch their production lines to make things that are needed during the crisis. And then also when you talk about New York, do you expect the numbers to be as severe here, given that we're less densely populated and people use public transportation less? Like the situation is not exactly the same.
So let me start with that. It's true that parts of the New York metropolitan area are more densely populated. Of course, you think about Manhattan and some other places in some of the outer boroughs than Los Angeles. But as a metropolitan area, and public health officials told me we should really think about the spread in a metro area. Even LA County isn't a big enough catch basin. It's really Ventura, San Bernardino, Riverside, Los Angeles, and Orange together, which is one continuous city now. That we are the densest populated metropolitan area in America. And the New York area, which includes towns like New Rochelle, which are not necessarily about having heavy public transit or heavy density, that is only the 5th densest metro area in America. So we absolutely do have density here. We'll see over time. All of those things, I'm always hopeful. If we could be a place that has less because of the space that we enjoy, or that more people have single-family homes, et cetera. But in this, the homeownership rate in New York City is actually higher than here in the city of Los Angeles. So I do think we have quite a bit of density. We do gather, and that's why it is so important to space out. In terms of the industrial incentives, I didn't say that we would have industrial incentives. We've been coordinating, though, with a lot of folks about being willing to buy, whether it's through apparel industry, folks who have sewing machines and sewers that are here, looking at masks, protective equipment, medical equipment, as the county calls on those things as well. So we are well into that. The Business Operations Center is overseeing that. And I'm proud to announce tonight, too, that Gene Soroka, who is the executive director of the Port of Los Angeles, the busiest container port in the Americas, is taking on all the supply chain and supply line issues of buying, procuring, whether that's local, where he has contacts with warehouses, manufacturers, whether that's international and bringing things in, or whether it's national across the United States. So I think Los Angeles has some real superstars able to do that, as well as industry that's here. And in terms of the sober living, let me get back to you. I don't think that this would cover that. I don't know that I have the power to do that, but I'd have to look at the funding on sober living facilities. If we can, I absolutely will. Also, I know folks have asked about a rent freeze. And I would say this, I'm very supportive of a rent freeze. I think that would be a great thing for us to see, even statewide. So I'm talking to other mayors about that and talking to the governor's office. But the state has that authority. We have that only on rent-stabilized units, and I've been in contact with many council members, from Councilmember Mike Bonin, Mitch O'Farrell, and others, about what power we could do here to at least freeze that for rent-stabilized units. We hope to get back to you in the next couple days and see what those conversations at the state level may yield. Next question, please.
And we'll go to Carla Hall with LA Times. The line is open.
Hi, Carla.
Hi, Mayor. I have two questions. Both are about homeless people. In the court documents that the city filed in the matter that Judge Carter is hearing, they said that the county was trying to access, or is going to access, 2,000 hotel rooms that would be used exclusively for homeless people. What's your knowledge about the status of how that's going, how many the city might get, and would you prioritize putting homeless people in those over the shelters? And then the second thing, real quickly, is there have been some reports that the hand washing stations that are now up, some of them don't have water.
So let me get back to you on the second one. I'm sure that that's happening and running out. We're trying to get out there as often as possible, and there's heavy demand. But let me get back to you. We want to make sure we're rolling out other ones. There's been a few that have been damaged, but by and large, people are respecting them, using them, and we're going to try to have a historic amount, not only of hand washing stations, but of bathrooms and other things that are there. So let me get back to you on that. In terms of the hotel rooms, the county and we have been working together, and I think other cities too, using some of the state money. And yesterday we received $19 million for the homeless emergency grants from the state, from our legislature, and from the governor, and we're very grateful for those dollars. To lease up as many hotel rooms and motel rooms. I was just talking with Catherine Barger, our chair of the Board of Supervisors, and my staff. Were about 600 of those, I believe, the county has already secured. We're referring, and thank you to council members like Gil Cedillo and Joe Buscaino and others who have referred hotels in their districts. So we're helping them get those done. We did say that in the court proceedings. We hope that, and that's the plan, is to get to about 2,000 of those, and we can help our hotels and motels, which are empty and they are threatened with being shuttering. So it's good for the industry, it's good for homelessness, it's good for health. But in terms of having a preference, we are almost at capacity with the first 8 shelter locations that we've done at our rec centers. By this weekend, we'll have the 13 open. We'd hoped to have that done earlier in the week, but we had to change some of the spacing and the staffing. We're looking everywhere for medical personnel. So that website that I mentioned will really help us make sure that there's nurses and others to keep an eye on folks, take their temperatures and make sure they're asymptomatic. But of course, as long as we can have also medical personnel who can keep an eye on folks, the county motel rooms are mostly for folks who are exhibiting symptoms and the expectation that the numbers could get up that high, which I think is probably a middle of the road, if not conservative, estimate to how many people who are unhoused could contract COVID-19, just looking at the numbers across our population. So we can't have too many hotel rooms. We're going to use the state dollars. County's doing an excellent job with that. We're partners with them, as are other cities. And we will look to those. If we can find for asymptomatic people enough bedrooms that are not in a shelter environment, sure. But I think the judge acknowledges, we acknowledge, the county acknowledges, that's going to be a very tough number to get. So let's do all of the above instead of just some. Next question, please.
Thank you. And we'll go to Veronica Miracle with KABC. Please go ahead.
Hi, Veronica.
Hi, good afternoon, Mayor. There are thousands of Americans who are stuck overseas right now, unable to get home, and we've actually spoken with a couple of Angelinos who are stuck in Peru, which is currently under martial law. They say the embassy there and the State Department has failed them. Can anything be done for these Americans at the state or local level?
Absolutely, we can bring them home. And I know I listened to the Secretary of State talk about how the federal government would take responsibility and should take responsibility to help these folks get back. This is not an issue anymore of one country having it and another one not. Every country wants to close its border, but it's kind of laughable now because every country has this. So the greater threat is domestic for everybody. And whatever we can do to bring those Americans back home. But those that are stuck out there, stay where you are. Look out for yourselves, quarantine, especially in countries where there's high incidence, and hope that the State Department will continue pushing forward. Ambassador Nina Hachigian, who's our deputy mayor for international relations in the city, I know has been in contact with our consuls general, and anybody here who has somebody in one of those countries, we are happy here in this city that has more consulates than all but 2 cities in the world to work those connections to see if we can get word back and help those folks through the countries that they're stuck in government to get home. Thanks for that question and remembering those folks. Next question.
Thank you. And our last question comes from Leslie Marin with CBS KCAL. Please go ahead.
Hey, Leslie.
Hi, Mayor. So we know that of the positive coronavirus cases here in LA County, I believe 42% are people within the ages of 18 to 40.
That's right.
Do you believe it is because this age range is getting tested more, or do we know what's behind this?
No, we are right now, because we've had limited testing, what the county has done and what hospitals and clinicians are doing is testing those who have the worst symptoms. Those who qualify. So if those folks are coming through, it's not because they're being targeted, it's because they're being afflicted. And I'm really glad you raised this because I think people think of this as an old person's disease. It's not. This is not just about seniors. This is about everybody. This can be children, these can be teenagers, and certainly young adults, and those who still think themselves young adults, all the way into their 40s and 50s. Half of it is about above that midpoint line in our lifespans, and about half so far is below that. So this really requires all hands on, all of us to take this responsibly. And I want to thank a lot of the influencers out there. People, I mentioned Russell Westbrook, but people like Miley Cyrus, people like LeBron James, people who are really getting that education out there and letting people know who are younger, this is about you. This isn't about them. This is about us. And so we see those statistics, but we have no reason to believe that it has anything to do with targeted testing. It's only coming from referrals of doctors, and as such, it is very sobering for all of us. Thank you again to everybody who's tuning in for the English and for the press. Thank you for getting the word out. The press, by the way, I want to thank them because they've been putting themselves out there on the line, out there to get us the stories, sometimes going to locations. Be safe, keep yourself safe as well. And now I'll say a few words in Spanish. Let me just scroll down. So, Muy buenas tardes, Los Ángeles, y gracias por venir esta noche. Desafortunadamente, hoy, el condado nos informó del primer fallecimiento de alguien menor de 18 años por el coronavirus en el condado de Los Ángeles. A la familia de este joven, Los Ángeles está llorando con ustedes. Lo siento mucho. Y para todos ustedes quienes están con nosotros esta noche, especialmente los jóvenes que quizás no han entendido que están más protegidos en casa, sepan que esto es serio y todos estamos en riesgo. No hay nada más importante que evitar la propagación de este virus y mantener a la gente en buena salud y salvar vidas. Ese es nuestro enfoque y por eso estamos proporcionando pruebas de detección. El domingo lanzamos una página web donde la gente de mayor riesgo puede registrarse para recibir una prueba en uno de 4 sitios en la ciudad. Para el final de hoy, estamos en camino para hacer 2,800 pruebas, con la capacidad de redoblar eso en los próximos 3 días. Estas es buenas noticias. Y esta noche también estoy anunciando el programa de embajadores comerciales más protegidos en casa. Este programa es muy simple. Si hay un comercio no esencial que no está cumpliendo con esta orden, trabajadores del servicio de desastre y voluntarios de mi equipo de respuesta de crisis se unirán al Departamento de Policía para obtener cumplimiento voluntario de nuestra orden. En casos de falta de cumplimiento, ¿estás listos para desplegar a estas personas, identificar comercios y emitir una advertencia? Y si es necesario compartir información con la policía o dar una infracción. Junto con esto, el fiscal municipal está ayudando a implementar a estas medidas y gracias a Mike Fuhr por su liderazgo. También estamos buscando nuevas maneras para que el público sea parte de esta lucha. Y lo que necesitamos más que nada son profesionales médicos, enfermeras, técnicos. Por eso hemos creado una página de web muy fácil de utilizar donde profesionales médicos pueden registrarse para ayudar. Si es un profesional médico y quiere ofrecer apoyo al esfuerzo para combatir el coronavirus, ya sea pagado o como voluntario, vaya a la página coronavirus.lacity.org/medical worker. Llene el formulario y le contactamos. Te necesitamos. Además, somos afortunados en Los Ángeles a tener grandes compañías listas para ayudar. Una de ellas, Riot Games, está donando más de $800,000 a grupos sin fines de lucro locales, incluyendo $200,000 para el fondo del alcalde para apoyar a los que más necesitan ayuda por el COVID-19. Además, Riot Games está donando equipo de protección para el personal de nuestros hospitales, incluyendo mascarillas para médicos y enfermeras. Gracias, Riot Games, por su generosidad. Hace unas semanas me uní a la Asociación de Mercados de California para asegurarlos a todos que no deben de abastecer nuestros supermercados porque las cadenas de distribución continúan. Esta tarde, la asociación lanzó la campaña Suficiente para Todos para emitir el mismo mensaje. No se apure para ir al mercado. Ellos mismos le están asegurando que hay suficientes productos para abastecer y suficientes camineros para entregarlos a nuestros mercados. Estamos muy agradecidos con ellos. Por favor, hagan caso. Les recuerdo que deben tener esperanza porque cada día tenemos la oportunidad de tener un impacto, a salvar las vidas de nuestras familias, vecinos, nuestra comunidad. Todos queremos que todo regrese a lo normal. Y aunque algunas están hablando de una fecha cercana para terminar esto, la verdad es que no podemos determinar el futuro y no sabemos cuánto va a durar. Tenemos que prepararnos para luchar a largo plazo. Lo he dicho desde el principio. Todo se puede reemplazar, todo se puede construir de nuevo, con excepción de las vidas perdidas. Lo más importante es proteger la salud de tu familia y tu comunidad. No importa quién eres, puedes tener un papel muy importante. Sabemos que el coronavirus no se va a desaparecer así fácilmente. Nuestras acciones van a determinar cómo salimos adelante de esto. Entonces, quédense protegidos, quédense en buena salud, quédense en casa. Fuerza, Los Ángeles, y amor, estamos todos juntos en esto. Thank you, Los Angeles. I'll see you tomorrow.